I'd say it started when I was in 7th grade. Up until that point, I was a big kid, but I had never been called fat before. And I remember the day I went to school. It was before school started, and we were walking down the hall, and there was just a kid there with his friends, and he called me fat.
When I was in 8th grade, there was a weightlifting board at my middle school, and I knew I could get on that board if I just dropped a few pounds after the season. And it was like the first time in my life that I had a motivation to drop weight. And so that's what I did. I went for it.
I was initially in 6th grade, in 6th grade. And I had recently transitioned from one school, from private school into a public school. I think the combination of just exerting myself 110% in school and trying to attain, really good grades and then be as best as I could on the football field, and then with the combination of having just switched schools, and then also there is some parental discord. I think just that combination created the perfect firestorm for my eating disorder.
In my mind, I had two choices. I had a choice of forgetting it and moving on, or I could embrace what he said. And I decided that if he was going to call me the fat kid, then that's who I was going to be. And obviously then I didn't know that was the beginning of an eating disorder.
And as a 13-year-old kid, I only used the knowledge that I had and did the best that I could, which at best was pretty bad. I just kind of took what the media fed me and worked out a little bit more, ate a little bit less, and I got my name on the weightlifting board, but I also turned into having a full-fledged eating disorder by the end of that summer.
From that point on, food became my best friend.
I didn't really realize what was happening. I just kind of thought I was trying to be healthy, trying to be proactive in my health, and I was really killing myself in the process.
So an eating disorder we would think of as any kind of disturbance in eating-related behavior that causes an individual really a myriad of different problems, problems related to one's kind of physical health as well as psychological health. When these problems are really kind of at their full force, it can become very, very difficult for individuals to function in even the roles that in life are most important to them. Whether it's their role as a significant other, functioning as part of their job or as a student, those things really kind of go by the wayside quite often.
My wife took our kids and left. And her thing was, I can't be around this anymore. You are not who you were. I thought that kind of would have jarred something to make me realize, but it didn't. I spiraled deeper than what I thought I possibly even could. And even at that point, I never thought of it as an eating disorder. I thought I was, people talk about the voice of Ed, and that voice told me that all I could hear was that I was damaged and that there was something wrong with me. It was never saying, you have an eating disorder. It was just something wrong with me.
Going along with, kind of some of the social stigma of eating disorders being only a female problem, we've found that it's enormously difficult for males to even acknowledge the presence of disordered eating symptoms, but then to take that all-important step to gather courage and come forward and say, I need help for this problem. Certainly, it's very interesting to hear a lot of the stories of our male patients here at Rogers in terms of just learning about their journey of how they've got here. And I would say that on average, comparing the prototypical journey of one of our male patients to that of a female patient, that journey is much more longer and arduous, and involves a lot of soul searching. And do I really want to come forward? Do I really want to talk about this with people I'm uncomfortable with? Do I really want to make this issue known to my family?
It took my mom and my dad and my brother and my sister-in-law to sit me down. It was Easter of 2016 and told me, they're like, you have a problem and you need to go get help. We think you have an eating disorder. And me being a guy, that's ridiculous. I don't have an eating disorder, because even in my head, I'm like, well, that's a female thing. That's not a guy thing.
I think it comes down to a two-part problem. I think that there may be, certainly some kind of gender bias even amongst clinicians to not really go looking for eating disorders when it's a male that's, sitting across from you in the therapy office. We stereotypically have come to view these not only as a society, but I think as a profession as well, as disorders that are in large part exclusive to females.
It was a huge shot to my ego to have to admit that I'm a guy with an eating disorder, because you don't hear that very often. I mean, I'd never heard it before.
Being a male with an eating disorder, particularly anorexia, is definitely something I still am, a little self-conscious about. I'm not one to go out and say, hey, it's not the first thing I'll tell any new person I meet or anything. And yeah, I definitely think that's a product of our society and culture, how we definitely kind of emphasize, kind of the be tough motto, and kind of keep things to ourselves.
We've already talked a little bit about just kind of some of the stigma and shaming that comes with, males having eating disorders, and I think, being upfront about that is a very, very unique struggle for a lot of our male patients who are, already on the doorstep and coming into treatment, or who we're communicating with and just considering treatment. And so being able to effectively help these individuals, help these men kind of address that shame, and help them to understand that you're not alone, and there are plenty of other males who experience kind of similar features, similar difficulties and similar concerns with body image.
I think we're chasing something that we don't quite know what we're chasing, and that's the problem, and that's when we really start to end up with problems like eating disorders or anxiety disorders or different things like that. We're chasing something that we're not quite sure what's there, and ultimately we'll never find meaning in it. To have a fulfilling life doesn't mean to not have struggles. We're always trying to chase this fake life that's out there, but when really we should just be embracing what our life is, to be thankful in our circumstances and to really become better people.
Whoever watches this or sees this, getting help is good. Getting help can save your life, and it's important, and there are people who care, there are people who love you, and people who want you to get help, and you need to listen to them and do what you have to do to make yourself better.
Professionals and your family, your friends truly have your best interests in mind, and it can be really tough to see that, especially in the depths of eating disorder. Sometimes some of the best decisions are the toughest to make, and sometimes you just have to accept what it is and go with it, and hopefully you'll look back on it as I did and see how beneficial it really was.
With the right treatment strategies combined with a lot of effort put forth from the part of the client, I think recovery and lasting recovery is the standard now more that we're seeing in a lot of cases.